Oh, yes, Virginia, yes, oh God, yes. But I'm actually a family doctor by profession. That wasn't the joke, but that premature laughter, though, that did remind me something. I want to welcome some very special guests tonight. This area over here, welcome patients from the Kitchener Methadone Clinic. But I'm a family doctor by profession. I graduated from medical school with a 79 average. A lot of people say I should be proud of that, but I'm not proud of that. I mean, think about it. 100 of you see me as a patient. 21 of you are basically fucked. You know, I skipped 2 classes in medical school. 2 classes. You wouldn't think that's a big deal, right? Every now and then it comes back to haunt me. I'll see a patient, I'll say something like, "Sir, your lab results indicate that you have thalassemia minor." Well, what exactly does that mean, doctor? Actually, I was kind of hoping you'd know. I'm afraid I skipped that class. We're going to have to Google. Google is a doctor's best friend. But I hate when patients Google their symptoms before they come to see me. Like the other day, I saw this patient, I said, "What brings you in today?" This patient hands me a printout they got from Google. This patient starts, "As you can see, I clearly have a twisted left ovary. I need an ultrasound and a surgical consultation, and I printed a prescription for pain medication. You just sign right here. If you don't mind, I'm in a bit of a hurry." I said, "Okay, let's just take it back a step, okay? With all due respect, let's just slow down a little bit. First of all, you're an 11-year-old boy. Okay, second of all, let me see that thing for a minute. Twisted left ovary. Fuck, I skipped that class too." I've actually been practicing for 16 years, and I'm proud to say that I've never said anything inappropriate to a patient. But sometimes they say inappropriate things to me. Like, I saw this young, attractive female patient. I walked into the examining room. She whistled at me. Then she looks me up and down. She says, "Oh, I got a hot-looking doctor." Well, I kept it professional. I said, "Excuse me, if you continue to speak to me like that, I'm going to have to put my shirt back on." But having practiced for 16 years, like, I've certainly observed some human behaviors that are pretty mind-boggling. Like, for one thing, patients seem to always have this overwhelming need to show me things that I really don't want to see. Really, it's like they think I won't believe them. I'm going to apologize to anybody who might be eating. I think everybody's done. But let's clear the air about a few things, okay? So, people, if you go to the bathroom and there's blood on the paper, I believe you. You don't have to hold it in front of my face. Okay, guys, you get an erection and it points way over to the left. I'm not referring to your movies, Jim. It points way over to the left. I believe you, okay? You don't have to put that in front of my face. Oh yeah, ladies, you think your left breast is bigger than your right breast? Actually, I don't believe that for a second. You can't be too careful about something, right? Now, another thing I've noticed, I don't know why this is, but every day in my waiting room, it's always the person with the loudest voice who has the most embarrassing problem. I don't know why that is. But check it out the next time you're in your doctor's office. Every day some little old lady will approach my receptionist and she'll practically whisper, "I've had a cough for 3 weeks." Some young guy will walk in off the street. "Hey, how's it going? Beautiful weather out there. I have an itchy nutsack." "Okay, sir, have a seat. The doctor will be with you shortly." "Oh, and whenever I get a boner, it points to the left. I thought I'd better show him because I know he won't believe me." You know, this is feeling very therapeutic for me. Another thing people do, lately, patients will use this phrase. There's a phrase that really annoys me. They use this phrase when I'm trying to get vital information from them. And the reason it annoys me, it's the only phrase in the English language that never gives you new information. And it's bugged me so much, now I use this phrase on patients. See how they like it. I use it on them when they want information from me. So now a patient will see me and they'll say, "Doctor, do you have my biopsy results? Is it cancer?" "Well, sir, I have your results right here." It is what it is. It's really sweet when I'm delivering a baby and the parents don't know the gender beforehand. Okay, I've got a shoulder, one more push, congratulations! It is what it is. I'm from the East Coast. I'm from a little fishing village, Cape Breton Island, Nova Scotia. Are there any East Coasters here tonight?
Oh yeah.
Okay, good. We got a few. More importantly, are there any Taliban here tonight? I just thought I'd better make sure. Because one thing about us East Coasters, we can take a joke. You piss off one of those Taliban, they can really blow up. Seems to be an Arab night tonight, doesn't it? But it was always my dream after I graduated from medical school to go back to I went to medical school here. I wanted to go back to the little town that I grew up in Nova Scotia. And that was my first job out of medical school. Like, I was so proud. I remember going right to Nova Scotia. I remember filling out the application for my first job. First question was, "Are you a licensed physician?" I've been driving since I was 16. There's a question, "Do you take any drugs?" The options are yes, no, and it says explain. Well, I ticked off no. Explain. I just graduated from medical school. I can only afford alcohol. I remember my first day at work. I remember my first patient. I couldn't sleep the night before because I had some huge debts to pay. And I started thinking, I'm smarter than those medical school professors. Like, they teach you to do a full history, a full physical, ask all these questions, then examine that patient from head to toe. I'm going to multitask. I'm going to see twice as many patients, half the time, make twice the money. So I saw my very first patient. This gentleman sat down while I was looking in his ears. I said, "Any allergies to medication, sir?" I'm pumping up the blood pressure cuff. I said, "Have you ever had surgery?" And I got to part of my questionnaire where I said, "Do you smoke?" And he says, "Well, I'm not really comfortable with this conversation." So the line I'm supposed to use, I said, "Is there anything I can do to make you more comfortable with this conversation?" And he said, "Well, if it's not too much trouble, maybe you could take your finger out of my ass." I stayed in the East Coast less than a year. I mean, the main reason I left, I came back to Ontario, I got sick and tired of reassuring patients about confidentiality, because everybody knows everybody in these little towns, right? And the last straw came when I saw this older female patient. It took what felt like a half an hour to get her to tell me why she was there. Finally it came out. She had an affair on her husband. She wanted to make sure she didn't have an infection. I said, "Okay, that's nothing I haven't dealt with before. I'll just get you to put your feet up in the stirrups. I'll take some swabs." She starts again. "I don't know if I'm comfortable with this." I finally lost it. I yelled at her. I'm only human, right? I said, "Mom, just put your feet in the stirrups." But I practice medicine in Ontario now, and the biggest difference, my practice, it's very multicultural. I've got patients, they speak every language on the planet, except English. And that led to a few misunderstandings, especially early on. I remember seeing a gentleman, and I didn't realize how much of a language barrier there was, because he just kept nodding his head and smiling and saying yes. And we were talking about exercise, and I told him that he should consider walking a mile a day. 3 months later, his whole community's pissed at me because nobody can find him. But I've really stepped up to the plate. I've learned all the most commonly used phrases in medicine in every language. So now, you name it, Greek, Arabic, Serbo-Croatian, I can say, "Where does it hurt? Come back in a week, open your mouth." But the phrase I've gotten the most mileage out of, like the one I use by far the most, I use this one up to 5 times a day. It might surprise you, but in Cantonese, Mandarin, and Vietnamese, I've learned how to say, "When was your car accident?" Final story. When I first graduated from medical school, my best friend, he was a classmate of mine, he had some bigger debts than I had to pay off. He went to the States, he got a job in a clinic doing physicals for insurance purposes. And we keep in touch. He told me they really practice assembly line medicine down there. So his first year, he cleared $100,000 US doing this all day. But then he figured out that you can charge anything you want down there. The more popular you are, the more money you make. So his second year, he made $250,000 US doing this. Hey, that's nothing. His third year, he was on track to make $500,000, but he got fired. I mean, I don't know all the details, but I guess a patient complained. This patient alleges that while he was having a rectal exam performed, he felt both his doctor's hands on his shoulders. It's not that funny. My friend lost his license. 10 years of post-secondary education. Now he's doing stand-up comedy for a living. Wait a minute, that's me. I'm out of time. I'm probably out of my license. Thank you.
Jon Peck, everybody.